Is that better, Dr. Nick?
Yeah. Guys,
that's the spot right
that's
there.
The spot. How's it going, guys? It's Dr. Nick here at Kalkstein Chiropractic, your Baltimore area chiropractor, and today I am getting treatment from Mike.
Hey, everybody.
Mike's going to do some shockwave on kind of my lateral leg down here. You'll see a little bit more once Carly kind of swings around, but I've been running a little bit more. Maybe jumped in a little too quick, or I'm just poor at recovery. But it's been giving me some issues down there. So Mike's going to help me out with the shockwave, get it feeling better, and hopefully I can run.
All right, let's get it started. Welcome back, everyone, to my conquest to shockwave the whole office. We have Dr. Nick today, and we are going to be blasting a very fun spot for him. He's going to enjoy this a lot. So we're going to start off pretty light, like you guys all know. But you can see we're kind of getting a little bit of a twitch response in his toes. So I can tell this is a nice spot to go ahead and turn the pressure up on. So Dr. Nick, let me know when we're about at that 4 or 5 out of 10.
Say right there's pretty good.
Perfect. Alright, so let's get right there and see if we can manipulate this foot a little bit and increase the intensity. Does this make it a little bit?
Oh, yeah.
Yeah. So let's pull it back and let's kind of go back in there and see if we can find some other spots up a little higher too.
Oh, wow, that's too much.
So let me turn it off. We found a real good spot there. We're going to just change the head that we're using. So this is our our widest diameter head that we have for the shockwave. We're going to just change it to a little bit smaller of a diameter, and just so you guys can see the difference. It's a 20 millimeter versus a 15 right there. They're both steel-tipped heads, so intensity-wise and how deep they can get is exactly the same, but we're just not going to be as wide, so we can kind of avoid these two bones right here a little bit better.
That's too much.
That's still a little too much.
Yeah, that's right on top.
Let me turn you down a tad, and then I'm going to bring it back over.
No.
Okay. Lower him a little bit more. And let's see. Is that better, Dr. Nick?
Yeah. Guys.
That's the spot right there.
That's the spot.
Gotcha.
So I'm a baby when it comes to this. So don't think this hurts too much. I'm just a wimp.
Now we do want to be at about a 4 or 5 out of 10 pain pressure threshold. So, you know, it's going to be a little uncomfortable for Dr. Nick. There's going to be times like right now where he's just got to ride that lightning. But we're going to get him taken care of. Again, just for the audience, this is definitely one of the more bonier structures because we've got these two nice big bones right here, and there's just not a lot of tissue right in that spot that we were just blasting. So, you know, that's going to definitely add a little bit to the discomfort. Now, as you can see back here where he's got a little bit more tissue to play with, it's not as bad, but once we jump into this spot here, we're going to want to lower that pressure down because it is going to be, you can see, it's uncomfortable. Now, we get a lot of good results with the shockwave because like we've talked about before in videos, you know, we're breaking down cells, so that is going to be a little bit destructive by nature. But especially in the case of Dr. Nick, this is just going to help him in his recovery and getting back to running a little bit faster, a little bit easier into that curve.
I'm good, but once you start getting more lateral, that's when it really starts to get me. I don't think I've sweat this much a day in my life.
All right. Yeah, we're going to spend some more love back here, kind of let him ease into it again. And we're really just focusing on the entire tendon that's right here. Now again, this is a running injury for Dr. Nick. He's kind of jumped a little bit too into the deep end with his training regiment.
Shout out to Charm City though. They hooked us up.
Yeah.
Me up with some nice running shoes.
Charm City did something really nice for all the doctors, did something really nice for all of our patients, and we're getting a nice little partnership out of everything, so we're really excited for that. Shout out to Charm City again. If you've ever gone to Charm City and bought anything in terms of shoes or running equipment, leave us a comment and let us know what you've purchased. Maybe we can start to do some videos with the Charm City guys as well. Maybe we'll get them on the table next.
We do. We need to show them some TLC.
Give Dr. Nick a break. Am I right?
Oh, I'm going to have to put deodorant on again.
All right, everybody. We are all done with the Shockwave treatment today. The average length treatment is anywhere from about 3 minutes to 15. For Dr. Nick, he was just shy of 9 minutes, and I don't think he would want any more than that. You know, once again, follow, like the channel. Come join me on my conquest to get everybody in the office. We're going to get them all squirming. Dr. Warren, you're next. Take it later, or see you later, everybody.
Bye, guys.